The modern public health system has changed a lot over the last 100 years. Once science fully merged with medicine in the 20th century, organizations and agencies were created to help control the spread of disease and other health threats. Over time, these authorities expanded their oversight into other categories, such as regulation, education, and immunization. And though many of us aren't spending our days thinking about these public health organizations, they became a huge focus in society during the COVID-19 pandemic.
We realized how essential public health is to the functioning of our country and of our world. And people who previously never really understood or even gave any moments of thought to public health were now understanding public health, epidemiology, viruses, and this is good. I think an informed populace is a good thing.
That's Dr. Sandro Galea, professor and dean at Boston University School of Public Health. He says that while the increased awareness many Americans experienced is a positive outcome, this win may not offset the damage done.
While public health did, I think, objectively, an extraordinary job of mitigating the consequences of a pandemic that was devastating but could have been much worse, that many perceive that public health has lost ground and they are less likely to trust public health than they were before the pandemic.
The success of public health agencies at protecting Americans heavily relies on trust. Unfortunately, public trust in government institutions has been declining for decades, and the pandemic exposed local, state, and federal health agencies to this criticism as well. A 2023 survey published in Health Affairs shows that people with low levels of trust were mainly concerned with politics having an influence on the health recommendations. In his new book, Within Reason, A Liberal Public Health for an Illiberal Time, Galea breaks down where he believes these perceptions stem from.
I do think that public health did its fair share of things that could be reasonably seen as having been politicized, but I think some other things are unearned. But be that as it may, I think public health is seen as having been partisan.
In other words, many Americans felt like public health leaned too far toward one side of the political aisle. Galea says it's possible that social media exacerbated this issue. The various platforms are infamous for viral headlines that don't tell the whole story, and when important topics were discussed in a forum where anyone can chime in, the scientific gold standard of peer-reviewed information was lost. During this period, some doctors and health officials were treated like celebrities. The nation's eyes were on them for a rare moment. However, Galea says that shouldn't be the goal of public health. Though he says some may disagree, Galea believes public health is most successful when it's invisible.
If public health is visible, it means that something's not going right. We are most successful when we are creating the conditions for people to be healthy and when people choose to do whatever they wish to do with that health. We need to recognize that health is a means, not an end. You don't live to be healthy. You're healthy so that you can live. So once you recognize it that way, our job is to create conditions so you and I can both be healthy, so we can choose to live however we should live. That means that public health is at its most successful when it's in the background. So that is in contradiction with a forward-facing role for public health. And I think we need to grapple with that, let go of the spotlight, and assume a critical position of shaping underlying social architecture on which health can be generated. That should be our role.
So while social media has proven to be an incredible tool for spreading information quickly, Galea believes it also took away some credibility of health agencies in the public's eye. At the same time this trust was wavering, people began to question the trade-offs they were being forced to make. Was isolation worth the mental and social price we paid?
People quickly came to realize, once people got over the initial fear, that that was a decision, that was a judgment, that involved making a trade-off to reduce some viral spread and to give up other aspects of living. When people saw their loved ones dying in hospital without anybody with them, because public health said, you cannot visit your loved ones in hospital, I think people thought to themselves, that's not how I want to live. That's not a trade-off I'm willing to make. So I think the public health wasn't flexible enough to recognize that there are trade-offs, that viral spread was not the only thing people cared about, that COVID cases was not the only thing cared about.
In retrospect, Galea points to the politicization, social media interaction, and strict guidelines as the three main factors that fed into the current distrust of public health. That's not to say they did a bad job. Some may argue that leading public health during a worldwide pandemic is an impossible task. But no matter the conditions, there's always room to improve, and Galea believes we need to be focusing on what those improvements are so that we're better prepared for future situations. One thing he points out is the intersection of health and politics. Science has long influenced policy, but it's a flawed relationship.
Policy has to dwell in many shades of uncertainty, much more than the science is comfortable with. Public policy often has to act when there is insufficient science.
Where research is fluid and open to change, public policy has to make concrete decisions, meaning the outcome isn't always the correct one. However, the phrase, "follow the science," which gained popularity during the pandemic, led people to believe that it would be a perfect line from research to policy, and that it would always be the right answer.
In public health, leaning into this follow the science notion, we allowed ourselves then to enter the space where decisions were being made on imperfect information, but we were embracing that as supposedly part of the science. And I think people see through that. The science is about complexity. It's about nuance. It's about difficulty of making generalizations. It's about observations that lend themselves in one way to one group and differently to another group. Public policy is a much blunter instrument and often has to respond to an act without having full information. And we allowed the two to be conflated. And that, I think, is a mistake.
So now that we've identified some of the failures, how do we adjust for the future?
Tens of thousands of people in public health worked really hard during the pandemic to do the right thing. And I think insofar as there are things that we could have done differently, it was very hard to see them at the time. So I think we need to approach the next pandemic or the next crisis from a place of careful dispassion, being careful that the science is the science, which offers inputs that then policymaking may take up or not, and may have to balance with other inputs that are non-scientific, and we need to accept that.
Some people may disagree with Galea and say that public health has the responsibility to make choices for the country, or that these agencies should be political to an extent. Galea welcomes this discussion. The point of his book and the main overarching failure of how the pandemic was handled is that society stopped having conversations. It became taboo to disagree with the science, a field that was built upon and thrives from constant questioning.
We should disagree about these things. We should have these conversations because that is how we learn about them.
As we have these sometimes difficult conversations, we'll hopefully be better prepared to deal with any future threats as a more unified society. You can find more information about Dr. Sandro Galea and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson. Coming up next week on Radio Health Journal.
Like a major class of drugs was made illegal back in the 1960s. And now we have the opportunity to bring that class of drug back in a careful way.
Are we entering an era of psychedelic therapy?
But first, is the cancer drug shortage a result of industry greed?
It's a generic drug and there's not much money to be made. And I thought it was pretty irrelevant that people aren't making enough money on saving my life.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
All that was a direct rebuke to the messaging that we get as older women, that we're sort of on this downhill slide of cognitive decline and frail bones, and certainly, we're boring.
A lesson on venturing outside your comfort zone. Then,
they're very able to put up with noise and traffic and all the other disturbances that humans bring to the environment.
Our long and complicated coexistence with white-tailed deer. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints Radio on Apple Podcasts, Spotify, or wherever you listen to podcasts. Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website, radiohealthjournal.org, or wherever you listen to podcasts. Follow us on Instagram, Facebook, and X for daily content, and tune in next week for another edition of Radio Health Journal.